Hello and welcome to today's webinar, Redetermination Progress Report. I'm Cassie Yazzo, Senior Product Marketing Director here at Cotiviti. Thank you so much for joining us today. Leah Dewey is an experienced leader in population health, clinical strategy, product development, and value-based outcomes. As VP of Clinical and Consumer Engagement Operations at Cotiviti, she drives product value for Cotiviti's consumer engagement and population health solutions. Leah is focused on improving healthcare outcomes by leveraging data and insights to drive closure and care gaps, improve consumer quality, and move population health across various cohorts and cultures. Today's topic is the Medicaid redetermination process. On April 1st, after nearly a 3-year pause due to COVID-19, states resumed the annual process to redetermine eligibility for Medicaid with all enrollees. Now, over 6 months into this effort, millions have lost coverage, with a large percentage having been disenrolled primarily due to procedural reasons. Leah will explore the current status of the redetermination process, share her observations, and discuss suggested strategies and interventions that plans should take over the next 6 months and beyond.
So let's dive in. As Cassie mentioned, Medicaid membership had dramatically grown since the public health emergency, providing coverage to nearly 93 million Americans. Managed care organizations received extra funding in exchange for not disenrolling members off these Medicaid plans. And therefore, for the past 3 years, members came on the plan, but they didn't have to re-enroll each year. This is important because when the public health emergency ended on May 11th of 2023, states and MCOs would begin the process of redetermining eligibility. It's been estimated that 15 million Americans would lose coverage over the course of this time period and process. This process of redetermining Medicaid members hadn't been done in many years. A recent study by the KFF Foundation highlighted that 65% of Medicaid recipients were not aware of redetermination actions needed, and half had never gone through this process before. This certainly creates a perfect storm for the enrollees, the states, and managed care organizations as they enter this unwinding period. If you can imagine, some of the challenges they'll face are, can these members even be reachable? Medicaid populations are transient in general, and if the managed care organization or the state haven't communicated with the member in the past 3 years, they may not have updated addresses or phone numbers for those members. Members may also need assistance with eligibility forms and submission, since they haven't done this in many years. There could also be some disproportionate impacts on members with limited English proficiency, as well as those with disabilities, or even a disproportionate impact on low-income communities of color, given that over half Medicaid recipients identify as Black, Hispanic, or other non-white race and ethnicities. Medicaid enrollees have poor health and are generally disproportionately more likely to have chronic conditions such as diabetes, hypertension, asthma, mental illness, or a substance abuse disorder. They could be in the midst of a hospitalization, recovering from injury or trauma, or even in the later stage of pregnancy when their Medicaid benefits are terminated. This massive and unprecedented challenge has additional complexities and barriers. We talked just about the importance of the people, right, the personal aspect, but let's think through all the other barriers facing these state agencies and the managed care organizations. First of all, the complexity of the process. It's very confusing right now. You see news articles left and right. Members are waiting in long lines. They're spending long hours on the phone trying to get to an agent on the other end to ask questions and to help determine if they're eligible or not. The state systems are overwhelmed. They hadn't done this in a while. State systems are also just hindered by lack of technology. Think about accessibility and the ability for members to even access the information in their primary language, or even have options for members with disabilities, has been challenging as well. And finally, the states don't have accurate information on members. We'll go through some of the results and some of the positive things that they're doing now, but it certainly has been a challenge with not having the right information and not having access to the right information to complete the forms. So let's go through some of the numbers. As I mentioned, 94 million were enrolled as of March of 2023. As you can see, as of November 1st, I mean, the numbers change daily, but as of November 1st, you can see about 70% are still remaining to go through the renewal process. That's nearly 2/3 of all renewals have to be processed in the coming months and into 2024. That's millions of Americans that even haven't gone through this process yet, and really provides a real opportunity for states and managed care organizations to continue to connect with their members and have a positive impact. About 9% have been disenrolled, 17% have their coverage renewed, and 4% are pending. Many states took 12 to 15 months to go through this process, but others did quickly terminate. As I said, it's hard to see some of the positive results, but 17% coverage renewed is great. And many others have been moved to other ACA plans or employer-sponsored plans, so they may not have experienced a gap in coverage. We have seen significant growth in even Medicare membership, as well as the individual market, and employee benefits changes over the past few months as well. But on the terminations, we see that the majority of members who have been disenrolled were actually found terminated for procedure reasons. This really happens when there's outdated information or because the enrollee doesn't understand or otherwise doesn't complete the renewal packets within a specific time frame. Not to mention if they're being communicated through postal challenges with getting the right addresses and even receiving the information. So a high percentage of members have been terminated for those procedure reasons. 29% truly were ineligible for the Medicaid benefits. Here we're seeing that the renewal methods are split in terms of ex parte renewals and the renewal form. States are required to first attempt what's called ex parte renewals. That's by using available data accessible to them to ensure that the member is eligible. This reduces administrative burden and can automatically renew members under the Medicaid benefits. States can use things like SNAP or federal IRS data or tax data or state wage data to help them determine if members are eligible for those benefits. This really helps in process and really reduces the risk of members losing eligibility for procedure reasons. Not all states are doing this uniformly. While over 57% are ex parte renewals, it's not so uniform, 99% in North Carolina down to 9% in Texas. Continuing kind of the state of the state and the status of Medicaid redetermination, CMS acknowledged that the large percent of disenrolled members was concerning, and in August, they sent letters to the states requiring actions to certain states that were not operating in compliance with federal renewal requirements. They immediately had to pause disenrollments for individuals who the ex parte renewal process wasn't really working. They had to reinstate coverage for affected individuals who had been disenrolled due to a failure or an accounting issue. And they had to make sure they notified members of that reinstatement of their coverage. CMS also required states to implement many mitigation strategies to prevent and continue to reduce the inappropriate termination of members and to help fix the state systems. Another area where CMS had stepped in was also to allow states to work to apply for state waivers. These waivers covered a variety of different areas, majority being in these ex parte renewals. They had to support members, additional strategies to protect enrollees during this unwinding period. They also supporting them with renewal forms and submissions or completions. They also had to provide updated contact information and create waivers so that they could facilitate additional enrollment strategies for their populations. Another example or another category would be states requesting waivers to extend the amount of time to take final actions on a fair hearing of requests beyond the standard 90 days. So you can see a lot of states have adopted these waivers so that they are doing their part in ensuring that the members aren't losing coverage. Let's talk a little bit about the impact on children. We know that 4 in 10 of Medicaid disenrollments and the 20 states that are reporting have been disenrolled. That's over 1.8 million children that have been disenrolled out of 4 million total disenrollments in these 20 states. That's very concerning. As of September, 500,000 children's coverage was reinstated by CMS. While the children's coverage may have been reinstated, the parents' coverage may not. So there could be a disconnect there. Their parents dealing with they have coverage for their children, but not for themselves. The share of children that have been disenrolled did range as well across different states, from 68% in Texas to 14% in Massachusetts. So some states doing better than others. We also know that nearly 2 out of every 3 adult women in Medicaid are in their reproductive years, 19 to 44. And as states beginning redetermining these eligibility, thousands of new mothers who became pregnant during the pandemic could lose coverage or are losing coverage. There is some good news, though. States that have implemented the optional 12-month extended coverage for postpartum care will have an opportunity for those members to continue coverage. Again, this is being tracked by the KFF on their website. And so I encourage you to go and look at those stats and see how does your state compare? What opportunities are there for continuing coverage under Medicaid under this provision for 12-month postpartum for your members as well? We mentioned it's going to likely have a disproportionate impact on low-income communities of color, members who are limited English proficiency, or those with disability navigating the health system. It also could have a disproportionate impact depending on where you live, your state, your language, your race, your ethnicity, and your access to care. And this geographical impact, we call it the coverage gap across the United States because there are still 10 states that have not expanded Medicaid under the ACA. Many of those members residing in Georgia, Florida, and Texas. Members in these non-expansive Medicaid states could have incomes now that are too high to qualify for Medicaid, but too low to qualify for marketplace insurance subsidies. That means they could join the already 1.9 million Americans that fall into this coverage gap. This coverage gap of uninsured members increases the financial burden of our healthcare system, as well as increases those uninsured rates. And uninsured members seek care in the emergency room and would also have in poor health outcomes affecting our healthcare system. They will also forego necessary care if they don't have insurance, leading to additional morbidity and mortality among populations. Next, we're going to move on to best practices and ways you can prioritize multi-channel outreach to your members, mostly for redetermination as the topic of today, but certainly the uses expand beyond redetermination process, and we'll cover that in a little bit as well. I wanted to walk through a small case study on a best practices for using text messages. In this particular campaign, a client used a variety of different text messages at different intervals throughout the course of the campaign. The first messages were outreach on the 60, 45, and 15 days from the member's enrollment date with a message about a reminder you're about to lose coverage if you don't connect with the health plan, connect with the state, and redetermine your eligibility. The second message was after they lost coverage to remind them it may not be the end, right? You may be eligible for the benefits. You may have been disenrolled because of procedure reasons. And so it's another way to communicate with your population to ensure that they can get back to you and maybe they're ineligible for Medicaid benefits. And the third message was that continuation of connection with the population is to collect those addresses, alternative phone numbers, in order to ensure you have the right information for the next eligibility period when that starts. We have a QR code here on the screen. We have some case studies that we've done if you're interested in downloading them. So let's get back to the patient journey. Every touch point, again, from patient engagement, from a simple visit to your website to checking for an appointment or receiving follow-up information about a new diagnosis condition, can be critical moments that matter for how a patient may choose to engage in their healthcare. In recent years, that patient experience has become the focus of a lot of regulatory programs. It'll be slightly lower this coming year, but still important. And it's important to have a year-round strategy that can address onboarding and retention, such as welcome, benefits information, birthday reminders, silver sneakers, assessments and surveys, continuing to collect information about your membership, health risk assessment, health needs assessments, even post-discharge follow-up or mock cost cap surveys. And then you kind of move on to the preventive care side, where there's a variety of different outreaches that can be done to help your population understand their benefits, assess high risk, such as overutilization of the emergency department, or provide telehealth options, or help them manage their conditions, or even help them with a maternity care. All of these have payouts and improvements in outcomes, lower costs, and will improve your member experience. So tying it all back to our topic today of redetermination, well, the goal would be to reach out to members in advance of the redetermination date, reminding them about the necessary renewal process to avoid a lapse in coverage and inform them what's coming. Providing with specific instructions to complete the process, including videos or a list of paperwork needed or links to what's needed. Outreach is critical to drive awareness and education around this important time and process, making sure your message is well crafted and enrolled in the Medicaid enrollees can understand what they need to do to take action. The health plan has many opportunities here to drive that personal engagement and capture information and drive an important member experience. And the member will be able to understand what's happening and what they need to do to accomplish the redetermination eligibility requirements. As I mentioned before, even if the member does lose coverage, statistics show that 4 in 10 people who are disenrolled off Medicaid and CHIP eventually re-enroll. And so it may not be too late. Highlights the opportunity to continue to communicate with your members and their populations so they consume and understand the information. And managed care organizations should ensure that their communication strategies involve multi-channels to collect members and meet members where they are. There's lots of opportunities for members to gain coverage through ACA or employer plans if they aren't eligible. Again, this is where those engage and transfer programs can be very effective, leveraging outbound calling or SMS messages to connect with members and leveraging those member experience hubs.